My name's Lyndell and I'm a professor at the Centre for Eye Research Australia. When we get awards like this, and I'm very grateful and very honoured to have been awarded this AVR award, is that it's not possible without a lot of encouragement and help along the way. And so the people who I know who have really helped me and have really sort of inspired me to think about research include Professor Robin Guymer, as well as Associate Professor Anthony Hall and Professor Justine Smith. These guys have been absolutely instrumental. They've showed me that you can be a great person, a great researcher and a great clinician, and showed me how you can actually mix your clinical work into big research questions, and also helped me think about how I can actually answer those questions. And that's how I actually end up in research. So my main areas of research are in uveitis, so ocular inflammatory diseases. And when I started out as a fellow really in this area, I was sort of told that, look, clinical trials, yes, they are the gold standard with regards to testing all of our treatments. But in uveitis, it's way too small. The diseases the disease is so rare. There are so many diseases that we call uveitis. There's no way you're going to get a uniform population to be able to test prospectively in a randomized clinical trial that any of these treatments are really going to be proven to work. And I'm really proud to say that over the years, through a lot of determination from my colleagues or my group in uveitis research, that there have been some groundbreaking randomized prospective trials in uveitis, which has led to us not only finding new treatments that work in non-infectious uveitis, but we've also found the best treatments available to treat specific conditions such as uveitic macular edema. And so that's something that I'm really proud of being a part of, is to actually say that we as a group have been able to really answer those really important questions and as a result guide clinical management of our patients. I cannot understate how important AVR has been in my career development, in that it was actually way back when I first started out as a researcher, that the AUREA grant, which is what AVR used to be called, the AUREA grant was my first ever competitive grant that I'd ever achieved. And that was a huge boost to my confidence that perhaps I might be able to make it as a researcher in ophthalmology or just in general. If it hadn't have happened, I'm not quite sure. It was almost like a sliding doors moment, right? That if I hadn't have gotten it, maybe then I might have given up rather than continued to persist. Having said that, all the grants are competitive and you do need a thick skin. But just having that first grant that, I can still remember it, it really was a really big thing for me. Always hold on to your curiosity, always ask those questions and never give up. I think also having great mentors and supporters or even great peers around you to help you along the way is also absolutely instrumental. I've had fantastic mentors who have really helped me along the way with regards to, picking you up when you didn't get your grant, through to asking you questions as to, do you really think your project's feasible? All of those questions, it's absolutely instrumental. I'm very honoured to have been given this award, celebrating women in research. When I started, there weren't many female professors or female researchers, and I'm well aware that there is still a long way to go with regards to encouraging more women to not only do ophthalmology, but also to consider research. And I do feel that, as a lot of people say, you can't be what you can't see. And so I'd like to thank AVR for thinking of celebrating women in research. And I'm very honoured to have received this award. And I look forward to hearing of all the other women in research in the future. also stepping up for this award. Thank you.